I started in January in the 2021 cohort. And my original major, I graduated from the University of Colorado Boulder in 2018 with a political science and chemistry degree. And I'm originally from Iran, but I grew up in Colorado. But the main job I wanted, looked at it, and it's at a PACU, and the nurse manager who I was having an interview with, the first 15 minutes of the interview was very, very standard. It's like, what's your 6-year plan or 5-year plan? How do you interact with colleagues? How do you interact with clients? And it was just like a normal interview. And then, I don't know, like 15 minutes went by, 20 minutes went by, and she said, so tell me a little bit about this clinic you want to build in Iran. I forgot I put my ePortfolio at the bottom. So I was taken aback a bit. So I asked her, I'm like, so I will answer that, but how do you know that? She's like, oh, it's because I looked at your UNE ePortfolio. And we had a great conversation about my UNE experience. We talked about some client experiences I had within HIPAA regulations, of course.
Mhm.
Might want to include that.
Thanks for clarifying.
Yeah, of course. But yeah, we had this great conversation, and I always think a great interview, it feels like a conversation.
Mhm.
And there's so many things we could talk about from UNE, that my ePortfolio from UNE, that it made it a really easy interview. The interview lasted super long, like 50 minutes. And at the end of the interview, she said, I'm a nurse manager at this PACU for 10 years. This is the most impressive interview I've ever had with a new grad. She said
Wow.
that, but yeah, so by the end of it, she said, I can tell that you have great interpersonal skills, you have great interviewing skills, and I can tell from your portfolio you really care about people and you really want to help others. And I want to offer you this job right now. But usually they give the recruiter emails you or calls you back in a day or two. But she's like, this was so impressive. I want to offer you the job right now.
That,
So it was just an incredible experience, and I really felt compelled to tell Dr. Cram like it got me my job, because I felt like euphoric. I felt so good after that happened. So I'm excited to start, because in the PACU they don't usually take students. They take 2 to 3 year experience, but they'll put me in with the ICU students, the ICU new grads, for 12 weeks of training in August.
when you think about the content that you shared, you talked a little bit about your ideas about a clinic, and that was the thing that seemed to catch that person's eye. What other types of content do you remember talking about?
We talked about so they were very interested in why I had went up to Maine, why I went to UNE. They asked me about some patient experiences that I had at UNE that were very compelling. It was a post about a patient I had when we were at the Peace. I can't say that. Sorry, I was going to say the floor. I shouldn't say that though.
Yeah, no.
It was about a patient that I had at Maine Med, that I had posted about in my ePortfolio essentially, and she had brought up a few of the specifics about him. So we discussed a little bit about that. She asked me how I felt about it, and how I responded to certain situations and stuff like that. We also talked about what my goals were at UNE, like when I first came in, and then how I changed as a person when I came out of UNE and stuff like that, and how I developed my, like, as a person. And it honestly, it just flowed so well. I don't remember a lot of the specifics we talked about. It just felt like a conversation. Didn't feel
Mhm.
like I was just answering question, because she was asking me questions, and then I kind of gave her an answer, and then I would go into the story, and it felt like it flowed really well because she went through my ePortfolio.
Do you think that your ePortfolio sort of helped you to see that growth for yourself?
Absolutely, it's like you can just go through the ePortfolio and you can really see kind of my growth as a person, my growth as a nurse, my growth as just my maturity level increasing as well. She got to see. I think the biggest thing is, like, I worked with you at the end of the semester, Professor Bullock's class, to fix my portfolio up. And one of the things I really wanted to do is, when you went through my portfolio, you could see my personality. Because in an interview, you can't get you. There's only so many questions they're going to ask, and a lot of them are preset. Like, I got asked the same question by nearly every employer: 5-year plan, how do you interact with colleagues, how do you interact with peers. But when you have your portfolio, if they really do look at it, they can, like, really grasp who you are as a person,
Mhm.
and they can get a sense of not just who you are with the questions, but who you are, behind the scenes. So she said, yeah, and not only that, I really care about patients, I care about people. And she just got another side of me, which she may have not been able to see outside of an interview with no UNE ePortfolio.